Hi, I'm Dr. Eran Bar-Kalifa, the PI of the Relationships and Psychotherapy Research Lab at Ben-Gurion University in Israel. My research mainly focuses on interpersonal emotional dynamics in the context of intimate relationships. I'm here to tell you about a recent paper that I published together with my student Wiesel and my colleagues Shahar and Rhonda Goldman. In this study, we looked at the role of expressing and recognizing vulnerable emotions during emotion-focused therapy for couples. In EFT and emotion-focused therapy, being able to be vulnerable and express vulnerability are crucial to the process of change. It is extremely difficult for couples to share vulnerable feelings such as fear, sadness, and shame. Usually couples avoid these feelings because it's such a huge risk to share and talk about them to others. What if my partner doesn't understand me? Even worse, what if my partners will think less of me because of them? Often, instead of letting their vulnerable emotions out, couples show secondary reactions, secondary emotions such as blame, criticism, demand, or withdraw and become indifferent. One of the main principles in EFT is to help partners access and be aware of their primary core pain. In couple therapy, this process is twofold. We first want to help each partner be in touch with his or her emotions, and several studies have already shown that this process often leads to better treatment outcome. But in couples therapy, we also want to help each other to recognize the other partner's vulnerability accurately. In other words, if my partner expresses loneliness or shame, I must be able to recognize it so I can respond to it. The literature has mainly dealt with the role of expression vulnerability, and in this study we went one step further and looked at the interplay between one partner's expression of vulnerability and the other partner's perception of this expression. More specifically, we tested the extent to which partners are accurate or biased in their perceptions of vulnerability during the session, and looked in particular at whether accuracy in perceiving vulnerability during one session is associated with better outcome for that session. We analyzed data from 36 couples struggling with unresolved emotional injury who took part in the York Emotional Injury Project led by Professor Leslie Greenberg. The findings point to the critical role of accurately recognizing expression of vulnerability. Accurate perceptions of vulnerability during a session were associated with higher levels of resolution of the emotional injury. This means that when partners were able to recognize their partner's vulnerable emotions, such as loneliness, anxiety, and shame, they were in a better position to move forward and resolve their lingering emotional injury. Strikingly, although participants were able to recognize and identify changes from session to session in their partner's expression of vulnerability, they tended to underestimate the extent to which their partners express their emotions. This suggests that when partners dealing with emotional injuries, such as a past affair, they may find it difficult and challenging to fully trust or acknowledge authentic expressions of vulnerability by their partners. This is unfortunate because failing to identify expressions of vulnerability can be detrimental for the partner who took the risk of expressing vulnerable emotions, which then went unrecognized, and for the partner who missed the opportunity to meet his or her partner on a deeper, more authentic emotional level. From a clinical point of view, the results suggest that when working with couples, therapists should pay more attention to the ways partners perceive each other's expressions of vulnerability. This may enable therapists to help the partners identify misunderstanding and misperceptions and explore obstacles that curtail partners' ability to see each other's more vulnerable side. So thank you for watching this video, and I hope that you will find our paper interesting.